Hello everyone, welcome to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri. In this episode, targeting IL-1, how Anakinra compares to other blockers. Let's widen the lens. Anakinra is a compelling tool in our anti-inflammatory arsenal, but it's not the only player on the field. Think of this like comparing different kinds of fire extinguishers, each suited for a different kind of place. To guide us through the comparative immunology of IL-1 blockers, I am joined once again by Aseema, a microbiology researcher with a passion for host pathogen interactions and a burning research interest in the gut brain axis. Aseema, welcome back.
Thanks, Gaganasri. I'm really excited about this one because understanding how different IL-1 blockers work is a bit like understanding the dialects with a common language. So they all speak inhibition, but their accent and timing make all the difference.
Beautifully said. Let's lay the groundwork. What are the major IL-1 blockers currently approved or in use?
Okay, so there are three main IL-1 inhibitors used clinically. That is Anakinra, Canakinumab, and Rilonacept. Each targets the IL-1 pathway but does so with very distinct structures and strategies. For example, Anakinra mimics a natural antagonist, kind of like a decoy key that fits into the lock but does not really open the door. Canakinumab, in the other hand, is a monoclonal antibody which is laser focused on IL-1 beta, and Rilonacept is a fusion protein that acts like a sponge, soaking up IL-1 alpha and beta before they reach their receptors.
We'll discuss all the three. Let's start with Anakinra. Mechanistically, what gives its edge?
Anakinra is a recombinant form of the endogenous IL-1 receptor antagonist. It does not destroy IL-1 alpha or beta, but it simply prevents them from binding to the IL-1R1. It's like reserving a seat at the table but never really showing up for the meal, blocking the others from dining. So, what makes it stand out is its broad activity. It blocks both IL-1 alpha and beta, and its short half life of about 4 to 6 hours. This means rapid onset and reversibility, which are invaluable in acute inflammation like cytokine storms.
So now contrast to that, is canakinumab a targeted approach?
Yeah, exactly. So, canakinumab is like a sniper, I would say. It specifically neutralizes IL-1 beta, leaving IL-1 alpha untouched. So it's a fully human MAB, monoclonal antibody, which with a very long half-life, around 3 to 4 weeks. That makes it suitable for chronic autoinflammatory diseases where sustained suppression is beneficial, like systemic juvenile idiopathic arthritis or periodic fever syndromes. But in acute illnesses, that long half life can become a liability, and it's harder to adjust or stop once you have committed.
So we can say Anakinra is like a dimmer switch and canakinumab is more like flipping the breaker.
Oh, that's a great metaphor. Yes. So Anakinra offers flexibility and precision, but Canakinumab offers duration and consistency.
Lastly, what about Rilonacept? It seems to sit somewhere between these two, right?
Yes, so Rilonacept is kind of a decoy receptor. It combines parts of IL-1R1 and the accessory protein with an Fc tail from an antibody, allowing it to float through the bloodstream and bind to IL-1 alpha and beta, neutralizing them before they even reach the cell surfaces. And its half-life is about 7 to 8 days, so it's more stable compared to Anakinra, but not as long-lasting as canakinumab. It's also used in diseases like recurrent pericarditis and CAPS, offering a good balance between breadth as well as duration.
So let's say we are plotting all these three on a timeline. Anakinra is quick and fleeting, Rilonacept is steady and weakly, and canakinumab is long and low maintenance. Can you say that?
Exactly. And also, each profile suits different clinical needs. In acute systemic inflammation, where timing is everything, Anakinra's fast action and reversibility are really critical. But in stable chronic conditions, canakinumab's durability offers more convenience as well as control.
So now let's go a bit deeper.
Okay.
Beyond pharmacokinetics, do they differ in how they interact with the immune system?
Yes, and also it matters. IL-1 alpha plays roles in early immune responses and in maintaining epithelial barriers, especially in tissues like the gut and the skin. By sparing IL-1 alpha, canakinumab may reduce disruption of those functions. However, in settings like COVID-19 or macrophage activation syndrome, that is MAS, where both IL-1 alpha and beta are upregulated, targeting just IL-1 beta might not be enough. That's where Anakinra or Rilonacept, which block both, might be more effective.
Important question. Do they differ in safety, particularly in the context of immune compromised patients?
Well, all IL-1 blockers share some infection risk, especially in patients with neutropenia or pre-existing immunosuppression. That said, Anakinra's short half-life allows it to be withdrawn really quickly in case an infection arises. And with canakinumab, adverse effects linger a little longer, but overall their safety profiles are well established, especially with proper patient monitoring.
So the takeaway here is that while these drugs all target the same family, how they target, how fast, and how long they target vary significantly, right?
Exactly. So choosing the right IL-1 blocker is like matching the rhythm of the immune system. You don't want to play a slow jazz tune when the body is dealing with a wildfire. And each agent has its niche, and their pharmacological personalities really determine the clinical fit.
Aseema, I would say this was a master class in immunopharmacology. Thank you for walking us through this comparison. It's clear that these drugs are siblings and not twins, especially in the IL-1 inhibitory family.
Oh, such a great way to put it. Always a pleasure to discuss science with you, Gaganasri.
On our next episode, we'll be taking a closer look at how hyperinflammation leads to organ damage and where Anakinra fits into breaking that destructive cascade. From blood to kidneys to the brain, we explore how immune overdrive can harm the body and how IL-1 blockade may help slam the brakes. As always, this podcast is for educational purposes only and does not substitute for medical advice. Please consult a healthcare professional for personal health concerns. Thanks for tuning in to Blocking the Flame. I'm Gaganasri. I'll see you next time.